is Medicare for all, because it isn't.
Because a public option drains the system of resources by allowing private. Average 45,000 people a year die in the U.S. because of a lack of access to health care.
Alec Rayshawn Smith, age 26, was found dead in his apartment on June 22nd. He was rationing his insulin.
The United States of America is the only major country on earth not to guarantee health care to all people.
0 people die every year from a lack of access because in Canada, you need health care, you get it. There is no lack of access.
If somebody knocked on your door and said, I'm selling fire insurance, and they give you plans, if your living room catches fire, we're going to come put that out. But not if it's your kitchen. This isn't like picking a bagel.
By the end of my 3rd year, I'll fight to pass legislation to complete the transition to Medicare for all. She's saying first, we are going to prioritize a public option. Retreat and hesitation before a single primary election signals a lack of commitment. Warren should have stuck to her guns. This should tell you that she's not serious about Medicare for all.
I am sick and tired of talking to doctors in this country who say to me, Bernie, we have lost patients because by the time they walked in the door here, they were too sick and they died and they could have been saved.
Me as a Canadian, we have universal health care. I don't have to deal with private insurance at all.
And then the doctor and the nurse say, well, why didn't you come in when you were first sick? My deductible was so high, I just couldn't afford to take the money out of pocket.
All I do is go to the doctor, then I come home. That's what happened.
I remember going to the pharmacy and we bought a vial of insulin for $3. Now I'm paying $380.
You got to defend the fact that today we have 87 million people uninsured and underinsured. This is life or death.
This is life or death right here. This is not an optional medication.
Will taxes go up for the middle class in a Sanders administration? And if so, how do you sell that to voters?
It's actually a tax cut because I'm eliminating the private taxes, premiums, copays, deductibles, every sort of fee that you pay to a private health insurance company. That's a tax.
Conservative think tanker accidentally argues that single payer could save Americans $2 trillion.
If you're getting rid of the private taxes, that's an effective tax cut.
I'm proposing Medicare for all who want it. You get to keep your private plan if you want to. I trust you to make that decision.
Even if you have private insurance, what choice do you really have? You don't have a choice of what plan you pick. Your employer chooses that. You don't have a choice of what benefits are there. Your private insurance company chooses that. In fact, more and more, because of the rising healthcare costs, insurance companies are limiting who you get to see, what hospital is in network or out of network. And if you lose your job, you really have no choice at all. You got no health insurance.
People don't like their private insurance companies. They like their doctors and hospitals. Under our plan, people go to any doctor they want, any hospital they want.
My plan for health care costs a lot of money. It costs $740 billion. It doesn't cost $30 trillion.
Status quo over 10 years will be $50 trillion.
How are we going to pay for it?
We spend twice as much as Canada and get worse results. The question isn't how can we afford Medicare for all? The question is how can we afford the current system?
The way this works is sick, health, end of conversation.
But someone who is going to stick to their guns is Bernie Sanders. In my first week as president, we will introduce Medicare for all legislation. And there you have it.
So think about this. Everybody in the country's covered, okay? Better quality care, and you get money back. I mean, that's what's going to happen with Medicare for all.
I will tell you how we'll do it. We'll do it the way real change has always taken place, whether it was the labor movement, the civil rights movement, or the women's movement. We will have Medicare for all when tens of millions of people are prepared to stand up and tell the insurance companies and the drug companies that their day is gone, that health care is a human right, not something to make huge profits. Medicare for all, when tens of millions of people are prepared to stand up and tell the insurance
Welcome,
everybody. Thank you for joining us tonight for a special Medicare for All event that we're doing here, focused on Washington State, but also including our federal movement. As Bernie said at the end of that, it is going to take 1 million of us to stand up. So we're very happy and proud here to say we are part of this million people movement, millions of people movement. And we hope that you join us in this. I first want to thank our man behind the curtain, Oz, for pulling this all together and making this come out as beautiful, I know, as it is, coming out on YouTube and across Facebook. Oh, all the platforms, actually. We're out pretty far tonight, I think, right? I'd like to introduce Amber King and Courtney Love. They are joining in tonight to help moderate our event. Do you want to say hi? All the platforms, actually. We're out pretty far tonight, I think, right?
Hi, how
I'd
are
like
you
to
doing?
introduce
My name's
Amber King
I'm
and
our
Courtney
Revolution Washington
Love.
Bernie
They are
Fat
joining in
Secretary
tonight
and a few
to
other
help
things, but
moderate
I'm just thankful for everybody. Hope
our
you're all doing
event. Do you
well,
want to say
safe in these
hi?
uncertain times, and I hope you enjoy the conversation tonight. I hope you're able to share the stream out, as well as be able to contribute to the Q&A questions on our YouTube. We'll also be monitoring Facebook and some of the other streams we have pushing out. But really just hope that you gain some information, ask questions, and have a better understanding of the solutions we have ready. To the Q&A questions.
Courtney, is there anything you'd like to say?
We'll also be monitoring Facebook.
Hello, and I'm Courtney Love, and I'm the Vice Chair of our Revolution Washington Burn Rights Coalition, and I'm excited to be here.
Thank you. So we are organizing a political revolution to challenge the power of the plutocrats and prioritize the needs of people and our planet. With your support, we are building a national grassroots movement of local groups powerful enough to win progressive issues, So we are organizing a political elect progressive champions, and transform our political systems and get big money out of politics. Tonight we are doing a town hall called HealthCare on the Brink. We put in Make Washington Whole because we have Whole Washington with us tonight, talking about our universal single-payer healthcare system statewide. What we want to focus on tonight is there is state and federal ready-made solutions. So there are solutions all ready to go out there. So we're going to show you what we all have there. So tonight for the agenda, we are going to have Melinda St. Louis. She's from National Medicare for All and Resolutions. She's the Director of Public Citizens Medicare for All campaign. Then we're going to have Georgia Davenport. Again, she is the field director with Whole Washington, and she will be talking about our state universal health care plan. And then we have some Medicare for All candidates with us coming up on the second half of the show. We're going to have a good big open Q&A so you guys can get to know who's out there fighting to enact these policies we desperately need. There's Mariana Everson. She is running for state rep in LD19. Jason Call, he's running for House Representatives in CD2. Christopher Armitage, he's running for the House as well in CD5. Rebecca Parson, she is running for the House of Representatives in CD6, and Joshua Collins, who is running in CD10 for the House as well. Then at the end, we're going to have some action items and real things we can do to change the way Medicare for All or universal single payer healthcare system is viewed by the public and how we can make changes today. So first, without any ado, would you please welcome Melinda St. Louis? Again, she's going to be speaking regarding a national Medicare for All movement and resolutions that we can do to help enact that. So Melinda, go ahead and take it away. First, without any ado, would you please welcome Melinda? Oh, we need to unmute. Again, she's going to be speaking regarding a national Medicare for All movement.
Thank you so much for having me. It's a real pleasure to be with you all. I'm in the other Washington. I'm in Washington, D.C. Right now, so it's a little bit later in the evening, but I'm really excited to to get to speak with all of you. As Rhonda mentioned, my name is Melinda St. Louis, and I am the director of Medicare for All campaign at Public Citizen, which is a consumer advocacy organization. We have been going strong for more than 45 years as the People's Lobby in Washington, D.C. and challenging corporate power in democracy. And we have been very active alongside our revolution nationally in advocating for Medicare for All and building a mass movement that we're going to need to win this policy. You know, I think we are now in a very critical moment of our country, you know, facing the largest public health crisis in 50 years at least with the COVID-19 pandemic, and this has really highlighted in just how broken and just how at a disadvantage we are as a country with our for-profit healthcare system as it exists. I have some slides. I think I need to be able to share my screen. The other person stop sharing. So now I'm going to pull up some slides here. I have some slides. I hope everyone can see this okay. So my screen. The other person stop sharing. So I just want to briefly go over, you know, what's wrong with our current healthcare system, and specifically what we're seeing right now, critically in the context of the pandemic, and who is profiting from the status quo, why Medicare for All really is the solution that we already have on the table and that we can advocate for, and importantly, how we're going to win this. This is something that we have to win, and we have strategies in place to do that. So as the introductory video very clearly laid out, our U.S. healthcare system is broken, and I think this moment, as I mentioned, has really laid bare the flaws of our current system. We do already pay much, much more than any other comparable country in the world per person on healthcare, and yet we get far, far less in terms of our outcome. We spend more than double per capita than any other industrial country, and we rank last among all these countries on almost every relevant health indicator. And what we have seen is that our for-profit system puts us at a dangerous disadvantage in fighting a pandemic like the coronavirus COVID-19. This is just a graph that just shows, in terms of our GDP, how much more than all these other countries we are already spending on healthcare. And this is only up. If we maintain the status quo, this will only go up and up. We also pay by far the highest for prescription drugs in the world. These are just some examples of some drugs, and sometimes it's double, sometimes it's 5 times what other countries pay, and that is because we allow profiteering off of sickness in the United States. But this is an interesting graph because it's not only that we spend more, double, but we actually spend more in public money. So what we're already paying in taxes is more per person for healthcare than all these other countries pay, and yet they have universal healthcare. And so that means what our taxes are going to pay for government employees, private insurance, that's going to Medicare, Medicaid, and our fragmented system. So we already are even spending in taxes what other countries are spending. And yet we have more than, you know, there are many different estimates. A low estimate is that 30,000 Americans die each year from a lack of healthcare coverage. That I've seen upwards of 45,000. That was before COVID-19. Nearly half of adults have reported not going to the doctor when they're ill or injured due to cost, and 1 in 3 adults report that they've skipped medical treatment that they need because they can't afford it. 1 in 5 say they skip a prescription or cut their pills in half because they cannot afford to fill prescriptions. We heard about people rationing their insulin. Now imagine And so, as I have here on this slide, our health outcomes are very low and much lower than in other countries. Infant mortality, life expectancy, and it's really important to point out that this is a very unequal situation in the U.S. It really depends on your zip code, on your income, of what your life expectancy is going to be, and infant mortality rate. So we see vast inequalities by race and by income and by zip code in the United States, and it's an unacceptable situation. So now, as we're facing this crisis, it's not just that healthcare should be a human right for every person, which I strongly believe. I think everyone probably tuning into this call believes. But what we're seeing now is that it's not just about our individual rights, it's about our overall safety as a country when we're facing a pandemic and a highly contagious disease like COVID-19. We have already seen patients receiving surprise bills when they've gone to get tested for COVID-19 in the thousands of dollars, treatment as well. And we expect that these surprise bills will be even worse as it becomes difficult to go to a preferred provider, an in-network provider. As the pandemic gets worse, people will not have the option of which hospitals they're going to, and they may end up be one of the 10,000 Americans a day already who get a surprise bill even when they have insurance. We're seeing that patients who have insurance, they're going to have to pay copays and deductibles. For many people, those deductibles are too high, and they discourage patients from seeking treatment. And in the context of a contagious outbreak like this, that means people will wait until they're sicker before they seek care, and that has very drastic implications. And we are now in our profit-seeking system, the treatments and vaccines that we need to get developed. We're using taxpayer money to do that through the National Institutes of Health and public universities. But historically, the government then gives these pharmaceutical companies monopoly protections to enable them to price gouge people. We need to make sure that's not the case. And finally, and the fragmented nature of our system with hundreds of different private insurance companies, it's very difficult to have a coordinated response in the same way that if we were to have a single payer system. And then finally, as we're seeing now with the economic downturn, with millions of people losing their jobs, having a system where our health care is tied to our employment status and people are losing their health insurance at the time when they need it most just lays bare just how cruel and outrageous our system is. So as I mentioned, the reason is that we're the only rich country that does not provide universal health care. The Affordable Care Act was an important step forward. Millions of more people did become covered, but there's still nearly 30 million who are uninsured. And importantly, even those of us who are lucky enough to have insurance see our copays and deductibles going up, and we have a lot of insecurity about, and we find ourselves facing surprise bills all the time. We could get into details about why that's the case. And 2/3 of families that declare bankruptcies in the United States is because of the crushing medical bills. And that's not just the uninsured. Now, I put out some statistics, but we know this isn't about statistics. These are hurting families, hurting individuals every single day. And just this week, a 17-year-old in Los Angeles who did not have insurance went to an urgent care facility after he was very sick with COVID-19, and he was turned away. And on his way to an emergency room, he went into cardiac arrest and he died. So this is happening right now, and it's a tragedy, and we cannot allow it to continue. I just really quickly, just again to make the point, this isn't just about Medicare for those who want it. Even those who are insured, even those with employer coverage, have had extreme difficulty in paying their medical bills. So the current system, even for those of us lucky enough to have insurance, it's not working. This is also hurting small and medium-sized businesses. To have employers have to provide health insurance is an enormous burden for business. Some businesses are paying up to $15 an hour per employee just in health insurance premiums. So the idea of this being a private tax is absolutely true. This is a tax that we're all paying already. And for employers, it's also an enormous administrative burden to try to figure out health insurance for employees. It makes it difficult to recruit and retain talented employees, and it makes our businesses less competitive than other countries. Here's a slide, another slide about the fact that medical debt is really bankrupting American families. So it really is our fragmented multi-payer system that's generating enormous administrative waste and profit, CEO pay, shareholder profit. It has nothing to do with providing care. 1 in 3 of our healthcare dollars is going to administration and profit, not to healthcare. And so imagine if that money was going to healthcare, how many more medical beds we would have, how much more protective equipment would we have for our frontline healthcare workers. We actually, in many hospitals, have more people working in billing than hospital beds, and that is because of our fragmented system. The primary goal of private insurance is to generate profit. There is the incentive of the business model is to bring in more in premiums than you pay out. So there's an enormous incentive to deny care over and over in order to maximize shareholder profit. And we are also the only country, comparable country, that doesn't use the negotiating power of our government to bring down pharmaceutical and medical device prices. It's an outrage that we allow the big pharma to price gouge consumer, patients, and the government. And so, as I mentioned, this fragmented system, it is $600 billion per year in administrative waste. So this is an enormous amount of money. So when we talk about Medicare for All being less expensive than the status quo, this is why. We can provide healthcare to everyone, and we can spend less than we currently are. And, this is just a slide just to point out that the reason we have this crazy system is just because of the outsized influence of big insurance companies and pharma in our political system, and the lobbying, the millions of dollars in lobbying, the millions of dollars spent confusing the public about what this would mean because of the enormous profits. In fact, 40 of the 500 most profitable companies in the country were healthcare companies, and the CEOs of these companies actually earn 71% higher than the median of Fortune 500 companies. So already extraordinarily high CEO pay. They're at the top end of that. And so we know we can do better than this. And this is not a pipe dream. This is already happening. It's already happening in other countries, but it's also already happening here in the United States with Medicare. Medicare provides, it needs to be improved, but it is a highly popular program for people over 65 in the United States. And it's very efficient. Medicare spends 2% on administration, and private insurance companies spend between 12 and 18% of dollars on healthcare, on administration. And that's not even counting all of the billing. So this is and Medicare obviously covers the part of our population that receives the most healthcare in the US, and yet they are much more efficient. So what we can do is we can improve Medicare to make it comprehensive, to include all of the things that are not included, like long-term care, vision, and dental, and for seniors, and to get rid of all of the cost sharing that seniors have to, the complexities that currently exist, and then expand that to the whole population. So these are the federal bills. HR 1384, introduced by Washington's own representative, Pramila Jayapal, and it has 119 co-sponsors in the House. It's a very serious bill, and then Senator Sanders' bill and S 1129 are both Medicare for All bills that we've been working to build support for. And so, what would these bills do? They, as I mentioned, they improve and expand Medicare. So it improves it. It includes all of the things that need to be included that currently aren't all prescription drugs, and importantly, long-term care, as I mentioned. This is critically important for seniors and for all of us and people with disabilities to be able to have long-term care in the home if you want it. And then to provide these comprehensive benefits and complete freedom of choice of doctors in a way that we do not have now. Because currently, you must go to a doctor that is in network for your insurance. Under Medicare for All, every doctor would be in network because there would be no networks anymore. So much more choice than currently exists. And it would eliminate premiums, copays, and deductibles, all of the out-of-pocket costs that mean people are not able to get care. And it would vastly simplify our system. It would be much more similar to a single-payer system like exists in Canada. It would prevent providers from using payments from the program for marketing and profit. So it would suck that profit making out of our system as well. And it would provide global budgets to hospitals so that they could actually get the money that they need to provide for the community that they're in, which is critically important because we see rural hospitals closing all over this country because people don't have insurance, and they have uncompensated care, and the hospitals are going under at a time when we need more hospital beds. But so Medicare for All would be able to put money where we need it in the communities when we need it. And importantly, it would allow Medicare to negotiate drug prices. And we could save hundreds of billions of dollars a year just in getting rid of this price gouging from pharmaceutical companies. So the political momentum, as we said, is growing for Medicare for All. It was a very popular platform for 2018 midterm elections for members of Congress. We know, as you know, every presidential debate, it was dominated the headlines. And importantly, as we've seen in the Democratic primaries so far, that actually in all exit polls in every state, regardless of which candidate came out on top, Medicare for All came out on top. The majority of voters said they support Medicare for All. Even in states like Florida and in Texas, we saw Medicare for All was a winning issue among voters. This slide has just a list of many organizations, unions, faith-based organizations, business organizations that have been supporting the Medicare for All legislation. And obviously our revolution has been at the forefront of that. But we are seeing our counterattack by corporations, as I mentioned. And so there's the Partnership for America's Healthcare Future, which is just this front group by insurance companies and pharmaceutical companies and big hospitals that are spending millions of dollars attacking the policy, confusing the public, spreading lies about it. And so that's why it's incredibly important for us to be building our movement and educating our neighbors about what Medicare for All really is. So I just want to pivot just quickly before taking questions about how we're going to win this. Now, we have been successful in really setting the terms of the debate, and this has become a very mainstream issue. Obviously, we're seeing attacks coming from many different corners, from industry, also from within the Democratic Party, but it's incredibly important for us to educate and mobilize the base and to hold politicians accountable to the truth about what they're actually saying and to take on the myths that are being spread. Our organizers toolkit, like town halls like this one, I think are extremely important. Meeting with members of Congress, going to their town halls, in district meetings, bird dogging candidates, local resolutions, which I'm going to talk about a bit more, different kind of canvassing, house parties, training, using social media. We have lots of tools available. So I just wanted to mention that, you know, especially during this pandemic, I mean, obviously we have to focus on the crisis itself, and we need to make sure we're getting the equipment to frontline providers. We need to demand that not just testing, but treatment for COVID-19 is made free to anyone who needs it. And so that has to be very important, but we also need to say this moment is the moment that means we need systemic change. There is no question we need it. If we're going to face another pandemic like this one, we can't have our fragmented profit-seeking system. So we need to demand our representatives support Medicare for All. As I mentioned, Representative Jayapal in Washington is the author. Representative Smith has co-sponsored, but but Representatives Cantwell, Del Bene, Heck, Larson, and Schreier have not yet signed on as co-sponsors. So it's important to talk to them about why it's important, especially right now, to take a stand on that. And then going even more locally, we are part Our Revolution and Public Citizen and many other organizations, the National Nurses United, many others, have come together in a coalition to pass local city and county council resolutions in support of Medicare for All. Seattle was the first city this last year that passed a resolution in support of Representative Jayapal's bill, which is extraordinarily exciting. And we now have a network of more than 300 local efforts happening around the country. And we have passed more than 30, including Los Angeles, including Chicago's Cook County, including small towns in Pennsylvania and Ohio and St. Petersburg, Florida. So we're showing that this is important, that this is a popular policy in red states, purple states, blue states, and we can get earned media by doing that, build our local movement, and get our local officials to be advocates as well, because our municipalities would save an enormous amount of money through a Medicare for All program, and obviously to protect the health of our communities. So there's a website there, Medicare #4allresolutions.org, where people can plug in, and there's a comprehensive toolkit that we have for folks as well. For some reason, my screen is not responding, but I'm pretty much close to the end, so I'll just I will leave it there and say that Public Citizen, National Nurses United, Our Revolution, Physicians for a National Health Program, and many other organizations are working on this at the national level and at the local level. And we'd love to be able to connect you in to other activists who are working on local resolutions. We have a webinar actually coming up next Wednesday on April 1st, which I can, make. If you go to that website, you can sign up to hear more about the local resolutions effort, and be part of that national network. So I will leave it there and answer any questions.
Can you give up your share screen for me?
Thank you so very much, Melinda. That was a beautiful presentation. We actually have some people I saw on Facebook Messenger commenting on it and how they want to get a hold of your slides.
Absolutely, no problem.
If it's okay to share, I do have them because you sent them to me, but if not, I'll hold on to them.
Yeah, sure.
Oh, beautiful.
Sure, go ahead.
Thank you for doing all that work and really getting in depth on what we're working on. Amber, Courtney, do you guys see any questions out there for Melinda, or do you guys have any yourselves?
I have not seen any. Have you?
Neither have I.
Any great comments or questions? I do see a lot of people in YouTube mentioning, they don't have insurance. They're part of that percentage that is uninsured. And of course, others, how it's underinsured, they can't afford to go. Anything major leap out at you?
Yeah, I mean, I think just that this pandemic is really showing where we're at in preparedness, in funding. We've really, the last 20 years have been a disaster for healthcare. I also do medical billing. And so I see a lot of these, I'd love to put myself out of a job because we don't need to have so much administrative paperwork. And I feel like insurance in general, people that are incredibly smart, talented, well-educated, and it comes to insurance and they're just like, I don't know what the hell this is. And so, I see that day in and day out, and, people have been strangleheld to their jobs for so long because of insurance, not being able to have that fluidity, and the benefits that this would do would just change this country immensely.
Wholeheartedly agree. Melinda,
I do want to say that there are a lot of compliments for Melinda's presentation and her delivery of it, and I wanted to make sure that was pointed out. Thank you, Melinda.
Yes, and hopefully we can get you to do this for more of our states. We plan on trying to do some of these meetings and focus groups as much as possible throughout the states. So hopefully we'll see your beautiful face even more.
Well, no, it's a real pleasure, and I really I do encourage folks to go to the Medicare for All Resolutions .org website, which is the coalition site that our revolution is a part of as well, and you can there is a map there, so you can see where there are efforts that have already been underway, but please add your town to it. And because what we want to be able to show, and so we have efforts, and then we have the toolkit that allows people, that provides, and we're going to have some updated talking points that are going to really focus on this pandemic and how we can write letters to the editor to make those points, and op-eds in our communities, reaching out to our local officials, and which we can be doing even now, even when we're cooped up at home, to be able to get prepared and to build the community and build the movement that we're going to need to really launch. And it's when we're through the worst of this crisis, we cannot allow this opportunity to pass, to say now is the time. We cannot wait any longer. We can't wait to face something else like this again, with our for-profit system that is just trying to profiteer off of people's illness.
We really appreciate it. We talked earlier, and I told you that, and Georgia is coming up next to speak about it. And I told you that we do have a statewide, a movement going for universal single payer here. And you said it'd be easy to fold that language into a resolution, so we can go to the city and county and do it all in one swoop versus having to try to go back. So I just want to let everybody know out there that yes, we're fighting for the national movement, but we need to bring it local, because sometimes it takes state by state by state to pass things, right? But what we're going to do is we're going to have to really start in the hyper local level and start passing them city by county by, to get the state to push it is one way to do it. So, Amber has her hand up. Did you want something before we say goodbye to Melinda?
Yeah, I just wanted to say, as somebody who's rather involved in the Democratic Party and politics in general, that now is the time. I mean, we're all kind of shifting to different meeting styles, but people are trying to get endorsements and resolutions passed. And if you are at all involved in that process at any point in time, anybody comes to your door, calls you, this should be the number one question you ask them is, do they support a single payer Medicare for all plan at whatever level of government they are running for office?
Right. Oh, and now that you said that and brought up, endorsements and candidates, I do want to make sure that everybody is aware that, our guests that we have on speaking today, the organizations, do not endorse. They do not endorse any of candidates that may be on tonight. I just want to make sure that's clear. Our candidates are fighting for what these organizations are working on. So,
thank you. I also wanted to mention, following up on what Amber just said, is that National Nurses United and who are really on the front lines right now of the pandemic and putting their lives on the line right now, they have been key partners. I mean, they have been leaders in trying to push for Medicare for all for years, and they also have a campaign right now that's called Patients Over Profit Pledge. So you can ask candidates to say that they will not accept any money, campaign contributions from pharmaceutical companies and insurance companies that are part of this Partnership for America's Healthcare Future that I mentioned, that is spending millions of dollars attacking Medicare for all. So there is a website called Patients Over Profit Pledge .org. And so it'd be good to encourage candidates and at any level of office to sign on to that pledge.
We'll put it into our vetting process. They'll have to do that to even get to, past the first line. So thank you for that, for the information. I did see that quickly, but I haven't been able to delve into it. So that's very important. So thank you again, Melinda, for joining us. Like we said, not only, for our national movement, but We really got to trying to figure out ways that we can get this done, because it's way past time for us to have a universal healthcare system. So we have an amazing grassroots group called Whole Washington here, and we have Georgia Davenport, who is the state field director. She is joining us next to kind of get into the nitty-gritties of what that means. This is our ready-made solution for Washington State, and so there's no reason why we're still hanging on. Georgia, did you want to?
Yes, I think I'm unmuted.
There you are. Yep.
Okay, awesome. Great. Thank you so much. My name is Georgia Davenport. I am the field director for Whole Washington. First, I'd like to thank you all for organizing this wonderful event. This is an amazing way to get together and communicate what we need to do to get universal healthcare and Medicare for all in this unfortunate time. So again, I really appreciate you having me on. I and others worked on Initiative 735, which I'm sure most of you on this call are aware of that initiative. It was the initiative to overturn Citizens United, and that passed 64% in 2016. It was a great initiative. It gave me lots of experience. And during that time leading up to the end of the campaign, a few of the main organizers in that initiative wondered what we were going to do next. And healthcare was one of the number one issues for all of us, because I'm sure, again, as some of you on this call are aware, it's really difficult for campaigns to provide healthcare for their staffers because it's so expensive, and campaigns are very short-lived. So many of us on that campaign didn't have health insurance. So we decided to start Whole Washington to get universal healthcare in Washington State. I don't know, are my slides up?
Yep, I got the first one noted.
Okay.
Oz?
Sorry about that. We got kicked out of the screen share, so I'm having to recalibrate. Give me 1 minute here, and I'm assuming that this slide that is in the media window right there, is that where we want to start?
Yep, I have it ready to go for you.
Okay, that's great. Let's get that over there. Sorry, everybody.
Oh, all good. Thank you again for producing this.
No problem. So I'm going to go to slide number 3, or is that where we want to start, where it's at?
The one that says, who is Whole Washington?
Yeah, the one that is highlighted.
Okay.
It's number 10.
All right, number 10.
So while we're doing that up, I have it on my screen too, so I can kind of use that as a cheat sheet.
Okay.
Whole Washington is a grassroots campaign, like I said, started out of Initiative 735. Some of the main organizers behind 735 are still with the campaign. We promote a state-based universal healthcare solution and national Medicare for all bills. Some of our achievements is our first campaign, we collected over 100,000 signatures with a 100% volunteer effort, and that was in 2017. So we're very proud of that. A lot of initiatives in Washington State do take 2 times to make the ballot. The first time, they're just kind of getting organized. They're building their volunteer base. And so we did really, really well for the first go. We also organized 10 barnstorms last year for Medicare for All. Some of our organizers, including me, went to the first ever Medicare for All hearing, historic hearing. It was just an amazing opportunity to be part of that. I do want to point out, Canada was mentioned a few times during Melinda's presentation, and I'm not sure if everybody's aware, but Canada actually passed universal healthcare province by province, starting with Saskatchewan. So we want Washington State to be the Saskatchewan of the United States. So I'll just go to the next slide. Talking about the bill a little bit, because we did actually have a bill in the Washington State Legislature. It was SB 5222, and that was sponsored by Senator Hasagawa and had 2 other co-sponsors. Now that bill did not get a hearing. It was in the legislature for the 2-year cycle. And so we're looking for a new sponsor going forward. So if anybody on the call has a great progressive legislator in mind, who you think would be a sponsor for that bill, it would be great if you contacted them. And let me know if you need like a script to do that. Just georgia@wholewashington.org. You can email me, and I'm happy to help you contact your senator or House rep. But if they don't pass it, we will. We're very lucky in Washington state to have the ballot measure, also called the initiative. We can circumvent legislators who are also coincidentally taking tons of money from private insurance companies and pharmaceutical companies, and for some reason, they have never let single payer bills have a hearing. I don't know if it's connected. Actually, I do. It is connected. So because 2 decades, we've had a single payer bill in the legislature, and they've never, ever let it out of committee, we decided to run that ballot measure that I was talking about before. Now, ballot initiatives need about 300,000 signatures to get on the ballot, but once they're passed their law, the governor doesn't need to sign it or anything like that. It's people power. That's why we really, really love ballot measures. I want to talk a little bit about what the Whole Washington Health Trust covers. Before the call started, Rhonda asked me to kind of talk about the similarities and differences between the Medicare for All bill and our bill. They're both nonprofit. Actually, a lot of the inspiration for our bill came from the National Medicare for All bills. It covers vision, dental, behavioral health, no deductibles. Very similarly to Bernie Sanders' bill, there's only a small copay for prescription drugs. I think for Bernie Sanders' bill, it's $200 a year, where ours is $250 a year. So really, it's not that big of a difference. Children are covered for free. Actually, similarly to Bernie Sanders' bill and UpHill's bill, it's been studied by Dr. Gerald Friedman. Dr. Gerald Friedman actually did our funding study and demonstrated that our bill will save $9 billion annually. And it's been vetted by the Department of Revenue here in Washington State and the Employment Securities Department to make sure that it's implementable. The number one question, if you gathered signatures for Initiative 1600, the number one question you usually get when you're gathering signatures is, how much is it going to cost me? And we knew we were going to get that question a lot. So we partnered up with Progressive Coders Network, and they actually came up with a savings estimator. It's like payment calculator. You can go to our website, wholewashington.org, and type in how much you currently pay for healthcare, and it will tell you how much you're going to save annually under our Whole Washington Health Trust. So that's a great tool. If you're ever talking to anybody and they're like, it's just going to cost me too much, nothing is free, because that's what you hear a lot online, is nothing is free. You can say, no, it's not, but here's how much you're going to save. And people can see that their real numbers come back to them, and that's a really great tool. So I've been getting this particular question a lot in the last month. What are we going to do? Because it's going to be difficult, if not impossible, to collect signatures due to COVID-19. Any initiative gets most of their signatures from large events like Pride Parade or Folk Life Festival. We get tens of thousands of signatures from events like that. And since all those events have been canceled, our board is considering suspending the campaign for a year, but the decision hasn't been made yet. Actually, there are a few board members I'd like to give a shout out to tonight who are on this call: Jason Call and Courtney Love. And I think one more is coming on, Rebecca Parson, but I don't see her yet. So thank you so much for being wonderful board members of Whole Washington. But we are going to be having those discussions. We've been gearing up to do a ballot initiative this year. We have over 200,000 pledged signatures. That's 600 volunteers who pledged to collect over 200,000 pledged signatures. So that's really an amazing amount. But the benefit to waiting is that we'll have another year to get those signature pledges. We really wanted to have 300,000 signature pledges going forward, and it'll give us another year to fundraise for the campaign. So what can you do to help Whole Washington? You can pledge to collect signatures. Just go to www.wholewashington.org/volunteer. And if you're not into collecting signatures, there's tons of other things you can do, like text banking. You can help plan events to do fundraising. Support only candidates who champion both state efforts and national efforts. Make sure that, I think that Amber was talking about this, any organization that you're part of where a candidate gets in front of you and you have an opportunity to ask them a question, ask the question directly. Will you co-sponsor Medicare for All nationally? A lot of candidates will actually say they support Medicare for All. I know one candidate in particular here 2 years ago, Dr. Kim Schreier, said that she supported Medicare for All. But then when you would ask her, will you co-sponsor the Medicare for All bill? She said, oh no, I have my own plan. So you got to be really, really specific in your question. And also ask them if they will support the Whole Washington Health Trust. You can donate to Whole Washington. Donations will help us print petitions and literature. And anyone who donates in the next 24 hours on our website, I'll send them a free bumper sticker. And also we have these beautiful red berets that you can get off of our website. This is one of them, and it actually has this really cool metal part that says Red Berets Medicare for All. And this is a local organization started by Laura Fielding here in Tacoma. And we've been sending Red Berets throughout the United States in support of Medicare for All. And you can see them in some of the pictures at Bernie rallies and that sort of thing. So you can get those on our website too. And I've already said this once before, but ask your representatives to endorse Whole Washington and sponsor our bill in the House or Senate. I think that pretty much covers Whole Washington. I'm happy to take any questions.
Can we get a close-up of that beret again, Georgia? Oh yeah, there you go. That's that looks like our friend.
Yep.
Who did that?
Christina Benson.
Oh, Bankston.
I don't know how to pronounce it.
Yeah, it's beautiful. I've seen some of her work, and she's a real trooper for everybody. Thank you. Go ahead, Rhonda.
She made Benson. Yep. She makes these beautiful. Oh, I love that. Yeah, I have a revolution, and I had with these hands cuffs from Christina. So we have amazing artists out there. So I know that we see people chalking and all that stuff, but you got to remember these other artists who are making these beautiful red berets and jewelry just to keep the movement going. Thank you, Georgia. So much. And then Melinda, too, real quick before, because I know you're going to be here for just for a little bit longer. I did see one message in the Facebook thread asking if your organization or some of these national organizations, do they endorse or help with the state movement, passing of universal health care, or do you guys strictly just stick on the national Medicare for All national front?
That's a great question. So, I mean, we are very supportive of any efforts to advance universal health care and recognize that that there are really important work happening at the state. In terms of where we put the majority of our focus, it is on the national bills, because that's we're kind of a federally focused organization. But as I mentioned, the resolution strategy that we have is very much the goal of that is to bolster both state and national initiatives. And the sample resolution, if you go on the website, there's sample resolution language that says that actually points specifically to, if there's a relevant state bill, put it in here, and then also in support of the HR 1384. So, and we certainly have mobilized our members at key moments in support of state bills like the New York Health Act that's being pushed right now in New York State. There's they actually have they had a decent chance of actually passing it through both the Assembly and Senate. So that's like a key moment to be trying to support that effort as well. But we would definitely be open to, to mobilizing our members in the state if that would be supportive, helpful at some point.
Oh, beautiful. Thank you so much. Okay, Amber, Courtney, your turn. Cues from the audience.
Yeah, I have a question from the audience. They were asking, is it possible to change our state of Washington laws to allow for online signatures? And how is that looking and how can people help?
So we've definitely been discussing that. I think Jason is waving his hand frantically. So maybe I think I can answer that, but I think that Jason has. Oh, okay. He's saying go ahead. So right now it's in the Constitution, the way that our ballot measures work. But we are going to be trying to pressure Governor Inslee and to enact basically emergency rules to make it so that we can collect signatures online, because I'm sure the legislature is going to find a way around and still be able to meet maybe virtually. So the people should have a similar option, because that is why we have initiatives, so that the people can have a voice when their legislators are not taking action. So that's going to be the tactic, the argument that we can use to influence Inslee and others to actually make an emergency act in that regard. But if anybody listening can contact them in advance of us starting that petition, that would be awesome. They need to hear from the people. Jason, do you want to add anything to that? You can just wave.
I was actually going to talk about, I've contacted Kim Wyman over the last couple of days. So mine was more about candidates and signatures for the ballot, which is somewhat relevant. And since we're in a bind with being able to do door-to-door canvassing, I asked Wyman's office if there would be some kind of workaround for that. And right now she has said no, not at all. So for all the candidates listening, we're still on the hook to actually get physical signatures.
I know I was just on the Tax Amazon YouTube stream that happened a few hours ago, and they were going to do an initiative to the Seattle city, and they only need 30,000 signatures, but they're going to do a direct mailing, and we actually were considering that as well. But to mail statewide, it would, in my estimation, it would cost at least $500,000 to do that, because our petitions are so large. We need postage to send to the person and then postage for them to send back. And we don't have $500,000 for a grassroots campaign, unless somebody on the call has $500,000, and then, just wait. We're a 501c4. You can donate as much as you want.
Anyone in the audience?
Yeah, we have a
Washington.org donate.
We have a
yes, Oz?
We have a question from Jill F. Is there any movement like Whole Washington active in Wisconsin, and how would I find out?
I think Tom from HealthCare for All Oregon might know if there's a Wisconsin branch of HealthCare for All.
I have relatives in Wisconsin and good friends in Wisconsin, and our trip to Wisconsin probably isn't going to happen in May. This is Tom Sinsick with HealthCare for All Oregon. I am on, you can go to the One Payer States site and go to the link there. They're tracking this issue about what is going on in the different states. They have the map of the different organizations. And my issue, it sounds like if Jill is from Wisconsin, Jill, give me a ring and let's start it going in Wisconsin. Why not? Somebody's got to start it. It's been going on in Oregon for 20 years, and we can help move things along. And I'd love to help with that process. But I do not think right now things are very active. I haven't seen Minnesota, the next door neighbor there, has got a thing going.
Thank you, Tom. And we're going to get back to Tom again just a little bit later here. He's got some amazing information to share with us. But thank you for answering that question.
I will say that not every state has the initiative process, so that's why we're lucky here in Washington State.
Also, I want to say, give a little shout out to all the other board members of Whole Washington watching and engaging in the chat. Thank you all. And one of them suggests, specifically to Jason, but it might be a broader solution. Maybe you can instead of online signatures, ask for a $1 donation, since people are not able to collect signatures to get on the ballot. Because the fee for candidates is $1 per signature, or the signatures themselves. Maybe if each volunteer who wanted to collect signatures for Whole Washington donated enough for that ballot to be printed, mailed, and returned.
I appreciate that suggestion. Actually, we have a workaround. We are going to be texting. We've actually uploaded the filing fee petition to our website, and we're going to be text banking for people to go print out the petition, and in a very protocol safe way, get signatures from family members or friends that they're going to be in contact with anyway, and then mail them back to our PO box, and hopefully we will be able to get the signatures that way. We are actually really leery in this time of economic crisis for asking people for donations. So we would much rather get the signatures than take people's money that they're going to need for bills and food in this uncertain time. But thank you.
Thank you, Jason. All right. Any other questions before we move on to our candidates? And this is where we want lots of questions coming through. They're going to introduce themselves, say a little something, and then we're just opening it up to Q&A. This is the time to grill them, ask them the hard questions. Go ahead, Courtney.
I do have another Whole Washington question.
Beautiful.
I'll just ask the question and let Georgia answer. But if one has healthcare coverage through Whole Washington's plan, and they travel outside of the state, are they still covered?
Yes, the provider that they see outside the state, just like if you have insurance now, will have to negotiate with the trust to get reimbursed. And questions like that, we actually have a really great FAQ portion of our website where most questions like that you can find. If you want to maybe something comes up later on and you think, oh man, why didn't I ask that? Our website is just a great source for all that information.
Excellent. Thank you.
All right. Any others? Going once. Thank you. Going twice. Third. Thank you so much, Georgia, for being on. And you can please, if you're able to, hang out with us, because there might be some questions later on that you might be able to answer. I know Melinda had to go. She joined us from the East Coast, and again, we're very, very appreciative of that. All right. So changing gears. So our next section, we're going to be talking to some of our endorsed candidates. We have with us today Mariana Everson. She is running for state rep in LD 19, Timber Country. And so she's going to delve into, we want her to champion this state bill if we're not able to figure out how to get it on as initiative. But we need more than just her. So anybody out there watching and who is a Medicare for All advocate, please get in touch with us. We are looking for more candidates throughout Washington State. Then we're going to be introducing Jason Call. He's running for Congress again in CD2. We've got Christopher Armitage. He's on the eastern side of our state running in CD5 for Congress. Rebecca, we have not been able to connect with her tonight yet. She wasn't feeling well, so she will most likely not be able to join us in time. But if she does, she is here?
She is.
Oh, yay! Sorry, I didn't see that doing this part. Thank you for joining us, Rebecca. So Rebecca Parson will be speaking as well, and she's running for Congressional District 6. And then Joshua Collins, he's running Congressional District 10. And as you guys should know, these are very, very, very motivated Medicare for All candidates. And let's go ahead and open it up. We're going to start with Mariana. Go ahead and introduce yourself. I'd like you guys each to either tell a little story or a reason why Medicare for All matters so much to you. So either personal or something from your district that you've heard while you've been out knocking on doors before we got the stay-at-home order. Please welcome Mariana. Oh, you're on mute, Mariana.
Sorry about that.
There we go. Oh, you muted yourself again. There you go. All right, you're good to go. Don't touch.
I'm not gonna touch. Okay. My name is Mariana, and I wanted to thank everybody that's been on the call so far. All this wonderful information that we've gotten from Melinda and Georgia, and thank you, Amber, Courtney, Rhonda, and Oz for helping us out with this. It's been amazing. My name is Mariana Everson, and I'm a registered nurse in LD19. I've been serving this community for the last 10 years as a nurse, and my heart breaks almost every day for my patients who can't get the care that they need. They can't afford care, so they choose to not get any and die anyway. And I think that this is completely morally wrong, and I am going to win my House seat in Washington State, and I'm going to Olympia to champion whole Washington and a whole host of other progressive policies, because the people in our district and across our state are dying, and it is not okay. It is not okay. And we have gone too long with this bullshit system that is killing us, and I will not stand for it another day.
Thank you, Mariana. All right, Jason, your turn.
All right. I'm gonna take a little bit longer than Mariana did. I wanted people out there watching to know. Mariana and I and Georgia used to be, but since she's moved, she's not. We were all members of the Washington State Democrats Central Committee, and so I want people to know that the activists, the progressive activists, the Medicare for All activists, and the whole Washington activists who are part of the State Democrats Central Committee, we did get support for Medicare for All passed. It is actually on the books as a state party resolution for the Democratic Party, as is support for whole Washington. As is, and Melinda had mentioned this when she was here earlier, a resolution that I wrote personally to have our elected representatives not take industry money. And all of those resolutions passed overwhelmingly. And so we have a problem in this state. Georgia alluded to it earlier, that you have the chairs in our state legislature, you have the chairs of the House and Senate health committees who are in the tank for the healthcare industry. They take bags and bags of money. These people, Eileen Cody in the House and Annette Cleveland in the Senate, take hundreds of thousands of dollars in campaign contributions from the healthcare industry. And Annette Cleveland, when Bob Hasagawa brought the whole Washington bill to the health committee in the Senate, Annette Cleveland wouldn't allow it a hearing. And nobody could even get it. Nobody would even sponsor it in the House because they knew how oppositional to it Eileen Cody would be. So we have a real problem in the state legislature. We have a real problem. I'm sorry, I didn't hear you there, Mariana.
I'm sorry. I was going to add to that. Imagine how wonderful it will be to have someone like me standing on the floor of the House in Olympia saying you take legal bribes, and that's why you won't put this bill in the committee.
Absolutely. So, but we have the same situation in the federal government. Pramila Jayapal is the only supporter of Medicare for All. Now, it was mentioned that Adam Smith had signed onto it back in 2018. And the reason he signed onto it in 2018 is because he got a challenger from the left in Sarah Smith. And Sarah pushed Medicare for All hard, and he realized that it was an issue in his district. And so he decided to join Pramila Jayapal in signing on for Medicare for All. But everything that I have heard out of Adam Smith's district right now is that he is I don't want to say he is no longer supporting. I mean, he's probably happy to have his name on the bill. Whether he is actively going to join that bill or whether he is going around his district saying that he supports that bill, I've been told that people have asked him if he still supports it and that he has said he is in support of the ACA. Or strengthening the ACA. So, you know, there's a lot of political theater going on here. But as far as the other representatives in Washington State, and that is the guy I'm challenging, Rick Larson, Rebecca's challenging Derek Kilmer, Joshua, his elected actually dropped out of the race, Denny Heck, and then who else do we have? Kim Schreier and Susan Delbene. All of these politicians, they are Democrats. They are these new Democrats who are they are corporate funded. The guy I'm running against takes bags of money, not just from the healthcare industry, but all of the other industries that are oppositional to progressive policies. And just at the town hall a couple of days ago, Rick Larson said that he does not support Medicare for all. I mean, we've got these people on record saying that they are not going to support these policies. So you people watching, if you really want Medicare for all, you have got to get involved with your local candidates. We have got to flip these people out of their seats. One of the things, so I wanted to make sure that people really understood what the situation here is in supposedly progressive Washington State. And I'm remiss in mentioning Chris Armitage. He's actually running against a Republican, so you know they're not going to support it. So we have to have a real come to Jesus moment on the left in whether we are going to be supporting Democratic politicians. I mean, we like to say, oh, the Democrats are so much better than the Republicans, but the corporate establishment wing of the Democratic Party, the DNC, they are oppositional to progressive policy. People have to come to terms with the fact that they are oppositional to progressive policy. They're oppositional to Medicare for all. They're oppositional to the Green New Deal, and they all take money from the industries who do not want these policies to pass. So who are you going to stand with? Are you going to stand with people who need Medicare for all, who need a living planet? Are you going to stand with people who are working for the polluters and the healthcare deniers? So obviously all of us here on this call know where we stand. My question is to the people out there watching is how hard are you going to work to flip these people out of their seats? So now I will talk about my personal story just very briefly. You all here probably have heard me say this before. The health insurance system, and it's not even a healthcare system, it's a health insurance system. It is a for-profit system that does not care about whether people live or die. If they can squeeze a nickel out of you, they'll keep you alive long enough to do that. If you're no longer cost effective to their bottom line, they are quite happy to let you die. So my mother had a routine surgery back in 2003. It was supposed to be a fairly in and out surgery. The surgery went wrong. They sent her, she wanted to stay in the hospital an extra day simply for observation. They were trying to send her home. She begged them, do not send me home. I do not feel well enough to go home. So they sent her home, and within 48 hours, she was back in the hospital. What she had felt was wrong with her system had gone wrong. Her bowel had ruptured. Not to get too personal with the details, but her bowel had ruptured and spilled into her body cavity. And she was back in the hospital, and she had to be in an induced coma for 3 months. Beyond that, she spent 2 years learning how to walk again. She was never right after this. It affected her economically. She was on a walker for the rest of her life. She was a 59-year-old woman who worked every day of her life and was suddenly no longer able to work and reliant on a healthcare system. She was reliant on lawyers to fight the insurance companies to pay what they didn't want to pay. She had to take second mortgages out on her house to pay her medical bills. And I know that everybody watching this right now knows somebody who's got that similar story where the healthcare system, because it is a profit-driven system, not a people-driven system, has failed them, has failed a family member, has failed a friend, and we have got to put a stop to this, and we've got to do it now. People over profits in every way, shape, and form. We have to move forward like that. Thank you.
Thank you so much, Jason. Really appreciate it. All right, we have Chris. Tom, did you have a question? We're going to go through these first before we got to a question, or do you think you needed it done before? Okay, let's finish these introductions and then we'll open it up. I promise. I promise. All right, Christopher Armitage, your turn.
Hey, thank you very much. And I want to just say how much I appreciate everybody putting this on and the opportunity to reach more folks. So my name is Christopher Armitage. I'm running against a Republican incumbent who votes along with Trump 95% of the time. They're actually Trump's Washington State fundraising chair. They were involved in a scandal 2 years ago when a video came out of them talking to Devin Nunes at a fundraiser and saying to the audience that they needed to protect President Trump. Our district is single digit red. We actually had a Speaker of the House who was a Democrat who represented this district. And Speaker of the House, Tom Foley, he lost his seat as a Speaker of the House to a Republican in 1994 after the assault weapons ban. And I am the sole challenger, the sole Democratic challenger to this incumbent. I'm also a 27-year-old working class guy. My father and grandfather were both in unions. My dad was with the railroad, UTU. My grandfather was a Teamster delivery driver. I enlisted in the Air Force when I was 18. I wanted an opportunity to escape a lot of the things that my family had struggled with, being uninsured and underinsured, being able to get college educated without crippling debt like I'd seen my brother go through, being able to have a living wage, being able to have guaranteed housing. I was security forces in the Air Force. I earned my undergrad in criminal justice and my master's in Homeland Security while I was active duty, including over the course of 2 deployments to the Middle East. Once I got out of the Air Force, I pursued stand-up comedy full-time, as I've been doing for years, and then decided to step into this race. And a big part of it is because I remember that feeling when I was active duty Air Force on a deployment, driving around in an up-armored Humvee in 60 pounds of gear and trying to figure out if I could afford on a staff sergeant salary to help my mom with her medical bills, help other family members with medical bills and different types of debt that just have been thrown onto people unfairly. And when I was active duty, I had incredible health care, and it was single payer, and it was universal for everyone who was active duty and their families. And that's called TRICARE. And when I would go to the doctor as active duty, I would tell them what was wrong with me. They didn't rush me out of the room because they weren't concerned about seeing as many patients as they could for billing purposes. And they didn't need to write long explanations and send them off to insurance companies to justify getting any little test done. The doctor could just say, you know what, I'm not sure you need it, but how about you go up to the 3rd floor, you get an MRI, you get an x-ray. That's how simple it was. And these doctors were salaried. They wore the same uniforms we did. There wasn't a profit incentive behind our treatment, and it was the best damn treatment I've ever had. And so that's part of why I fight for Medicare for all and for single payer universal health care. Because why doesn't my mom deserve that? Why don't my brothers deserve that? Why don't the people in our community deserve that? We're the only modern industrialized nation where children die from insulin rationing, where good, honest, hardworking people will go without healthcare and die or suffer or go bankrupt because of it. And I'm done with it. And I'm ready to fight just like everyone else here to make sure that ends. And as a Democrat challenger to a Republican in a district that was on the red to blue list, I've been contacted. I've been approached by folks who work in those fields, and I will turn them down every single day because for-profit industries don't get a seat at the table when it comes to taking care of people's health, not for a second. And so that's pretty much me. That's my story. Healthcare plays a big role in it. As a veteran, I talk a lot about being anti-war and about ending the military-industrial complex, but the healthcare issue goes straight to the heart, and I will never betray that ideal or that value because healthcare is a human right.
Thank you so much, Christopher. Really appreciate it. All right, Rebecca, you're up. So Rebecca is in Congressional District 6.
Hi, thanks for having me on. And so
I had a phone visit with a doctor, and they said I probably have bronchitis, so not to worry. And I am really passionate about single payer Medicare for all for a lot of reasons. You know, I myself am self-employed. I'm a small business owner. I pay for my health insurance 100% on my own, and I've gone without healthcare because I couldn't afford it. I've sat in a doctor's office and debated and decided, okay, I'll get this thing, but not that thing because of needing to watch the costs. And all around my district, which includes most of Tacoma, all of Kitsap County and the Olympic Peninsula, we have people who are really struggling because they don't have health care. There's one county where if you are on state health care, there's nowhere for you to go get drug treatment. So in Tacoma, there's only one place to go for alcohol detox. And so in places all over my district, people are struggling with drug and alcohol addiction, and they're dying waiting in line for treatment, while our incumbent, Representative Derek Kilmer, takes hundreds of thousands of dollars from the industries and the companies and the PACs that are stopping Medicare for all from happening, and really preventing these people from getting health care. And then across my district as well, you know, I have two of the counties in my district are the top two in the state for opioid-related deaths. And the industries that caused this are currently being sued by our Attorney General for causing the opioid epidemic. They did it in our district as well. And their PAC gives money to Derek Kilmer, and he opposes Medicare for all. And when he talks about it, and when people ask him at town halls, he just tells people lies about why it wouldn't work, stuff that is demonstrably not true. Medicare for all will help rural hospitals because for a number of reasons. Number one being it'll take the profit motive out of the healthcare system. Currently, one of the main reasons that rural hospitals are struggling is because it's not profitable to provide healthcare in areas that are not dense with population. And if you take out the profit motive and instead healthcare is based on what's best for human health instead of what's best for the pocketbook of CEOs and billionaires, then it becomes actually very doable to provide good healthcare in rural areas. So the drug and alcohol epidemic is one reason that I support it. I also, you know, the coronavirus pandemic is showing us how much we need single payer healthcare. You know, I had a town hall the other day with Matt Bruning from the People's Policy Project, and we talked about, you know, what would the coronavirus have looked like if we had had Medicare for all and people had been able to get tested and treated instead of you know, foregoing treatment or going and getting tested, finding out they have coronavirus, and then the hospital turns them away because they don't have insurance. So it's for so many reasons we need Medicare for all. And if we get a progressive president in the White House, we're going to need a progressive president to back them up. You know, I fully support Bernie Sanders, and you know, if Bernie Sanders is president, we're going to need a progressive Congress to get this legislation passed. And so that's why I'm running. I'm the only candidate in the race who does not take any corporate PAC or lobbyist money, who supports Medicare for all, the Green New Deal, and national rent control. Check out my website, rebeccaforwa.com, if you want to find out more. And thank you all for the opportunity.
Thank you for joining us tonight again, Rebecca. And please keep well. We'll try to get you through this and get you back in bed here as soon as possible. All right. And then last but not least, we've got Joshua Collins. Joshua Collins is running in Congressional District 10. Take it away, Joshua.
Oh, thank you. So I guess where do I start? This is like the fifth Zoom call I've been on today. I feel like we've all been spending a lot of time, like, you know, doing this like online organizing, and I'm really glad to see people adjusting to the fact that, you know, we can't really do stuff in person anymore. So I really thank you guys a lot for, you know, putting this on. This is really good. I started getting involved in politics because of just my own problems that I've dealt with in life. You know, I've been screwed over by so many bosses and just the healthcare system in so many ways. I got in a bad car accident when I was younger, and when that happened, my health insurance company didn't want to cover any of the stuff because it wasn't my fault and it was the other driver's fault. And so I ended up having my credit screwed up until I could manage to get the other person's insurance to pay, which took, you know, over a year. And that got me blocked from getting like housing. I had to stay in an apartment that was kind of overpriced, even though like my roommates moved out, and it really made my life more difficult. And it's just such a common story, just the various ways in which this this private health insurance industry like system kind of damages our lives. And I think this is I just think what we're dealing with right now with COVID-19 is just a magnification of what people in America have been dealing with for so long. Healthcare was already a serious crisis. Like the privatized health insurance industry was already a problem, and it was already a predatory industry that was ruining countless people's lives and actually leading to people being permanently injured, having serious illnesses forever, and even dying. And now we are just having more people see it. It's put a magnifying glass on the actual problem that we've been dealing with. And I think it's unfortunate that it takes a global pandemic for people to realize that healthcare should be a human right. I've had I haven't had health insurance for most of my adult life. I've just gone without it because I've lived in a situation where it's more expensive for me to purchase it than it is for me to pay for every single doctor visit that I actually do need out of pocket. And so I think that's what most Americans are dealing with, and it's about time we actually change that and get a single payer system, whether that's on the state level or the federal level. So I'm really happy for the work that you guys are doing. Whole Washington, you guys are doing great. So I really want to see our healthcare system change. And if Bernie Sanders doesn't become the next president, this is our other hope for getting a single payer system, right? So during this like crisis, I've had a lot of interactions that have just shocked me, but also have not been surprising. Just so many people just like that got their health insurance cut off. People who had jobs that were considered respectable and important and stuff, but because they're non-essential, they just get laid off just like that, and lose their health insurance the next day. I mean, that's such a ridiculous system, and I don't think anyone would agree that it's rational to have a system like that. It's not sustainable to keep on telling people that if you lose your job, if you for whatever reason, that you should just be shit out of luck. I mean, that's like I think if we can recognize that you shouldn't have to lose your health insurance under this situation, and that healthcare like testing and treatment for COVID-19 shouldn't cost you money. I think we should also be able to recognize that if you have, if you're diabetic, you shouldn't have to pay for that either. If you have other chronic illnesses, if you break a leg, if you get cancer, those things also shouldn't put you into debt, and they also shouldn't cost you money. You also shouldn't be denied care for those things if you can't afford it. So, I'm going to push for Medicare for all. I mean, as someone said earlier, Denny Heck still does not support Medicare for all, and he's about to end his career in Congress. So he will have spent his whole career without supporting Medicare for all, and I think that's just ridiculous, and it's a damn shame. And if elected, I would fight for it. I would do everything I can to get us single payer, because it's something that would not only improve my life, but it would improve my family's lives. Most of my family is going right now either without health insurance or entirely, or with health insurance that they can barely afford and certainly can't afford to use. So yeah. Anyways, like I said, thank you for having me on here, and glad to be here. Thanks.
Thank you. All right, so I'm gonna let Courtney and Amber take in the questions, but first, Tom had his hand up like during some of these, so we'll let Tom go while you guys are getting the questions ready to go.
And Jason, thank you so much for being so frank about who your legislators are, and I think I don't even know who your congressional people are, or the state people, but so there's a question out. What do we know about the new speaker in the Washington House, since there's never been a hearing or these hearings, and it's been stonewalled in the Washington House. What do we know about the new speaker there? Took place office in January.
That would be one of my state representatives, and she takes healthcare money. So I don't have a lot of hope for her to be an advocate for us, sadly. But we will pressure her nonetheless.
All right, excellent.
I think what we find is what's happening right now across the country, not just here in Washington State, not just with the four of us candidates who are sitting right here, is that you have dozens and dozens of candidates, really good, solid candidates that all of us here running for Congress have become friends with over the last 6 to 8 months. And they are all committing to Medicare for all, and they are all committing to taking no corporate PAC money. And I think the money out of the politics, I mean, I think we've known this for a long time, that how badly our political system is corrupted by the money that these representatives and senators, and I do want to say senators also right now. Nobody is challenging our sitting senators. I think is Patty Murray up this year? I'm not even sure.
No senators are up this
So
year.
neither of our senators are up this year. That's actually great because we have 2 years to figure out who we're going to run against Patty Murray in 2022, because Patty Murray takes hundreds of thousands of dollars from the pharmaceutical industry and other areas of the healthcare sector, and she will not sign on to Bernie Sanders' Medicare for All bill in the Senate. And the same thing for Maria Cantwell. We are talking about an entire U.S. Congress and most state legislatures that are fully corporate owned, and they are scared to lose that funding. But I want to tell people who are listening, and this is not to say don't give progressive campaigns money, because we have to have some money to keep the lights on, to print our literature. But my opponent has been there. He's seeking a 10th term. He takes $1 million+ every single cycle. So every 2 years, he's taking $1 million+, and he's taken 75% of that money from corporate PACs, now from various industries. It's not just the healthcare industry; it's the military-industrial complex, and it's various transportation industries and fossil fuel industries. But if you want to know how corrupt these people are, literally, Rick Larson back in November of 2019, he got a $1,500 check from TransCanada. And the very next day, he tweeted out support of oil pipelines that are destroying the environment. They're cutting through tribal sovereign lands. The tribal resistors, like the people, the water protectors at Standing Rock, and the Wet'suwet'en up in British Columbia, they are literally having to resort to build makeshift homes in the paths of these pipelines to stop these pipelines from being built through their territories and their homelands, because you already know that these pipelines are going to destroy the environment. They've already polluted the groundwater around Standing Rock, like we knew they were going to. But that's the relationship. The relationship is that these candidates get money and they turn around and they're going to do the bidding of their corporate donors. And that is why the grassroots movement right now at this time, even if Bernie Sanders is not our president, and I'm going to fight for him till the bitter end. But even if Bernie Sanders is not our president, it is so important to flip seats in Congress so that we have more voices like Rashida Tlaib and Alexandria Ocasio-Cortez who can stand together. And I'm not talking about the progressive caucus per se, because there's a lot of people in Congress who want to think they're progressive and they are still taking industry money. We have to have a full-on no corporate money. We have to change this system right now for the health of our people, for the health of our planet. We have got to get these candidates elected all across the country. So if you're watching somewhere from out of state, please find out who your local progressive candidates are and support them also.
Thank you, Jason. All right, I know there's more questions out there. Amber?
Yeah, I just wanted to ask, what do you think we can do? And this is a question for all of our candidates: is what do you think we can do about the lack of COVID-19 testing and the reliability of having the results known? Because it seems like there's very differing state by state, not only in testing procedures, but also people are really distrusting the process.
So I would really love to address that just because, so my background involves disaster preparedness and emergency response. I've worked in incident command centers. I wrote quick reaction checklists for base defense operations controllers and participated in large scale military exercises covering anything from a plane crash to biological weapons attacks. And our campaign actually just released a COVID-19 plan that, most of the plans out there right now are addressing how do we take care of people who are suffering financially and the economy. So our plan chose to focus more on the operational steps that it takes to be able to address this response. And part of it includes, with the authorization of the Defense Production Act, nationalizing the medical supply chain, at least temporarily, to create or augment medical fluid, gear, and equipment lines with active duty military assistance and Air National Guard assistance, research long-term supply chain disruptions and bring some of this production back to the U.S. permanently. And this includes COVID-19 testing and making it blanketed across the United States federally so that our resources can actually be used in the most efficient way possible. And this includes, a lot of the states right now, poorer states are going to get the bad end of that stick because states with more money have more leverage. And that's not what we want. We don't want a poorer state to get screwed over just because they don't have those resources. It also, the plan we released includes providing grants to companies to build and deploy mobile hospitals, new testing procedures, and any other resources that we need. This could be included, it could also involve a competition similar to the Google Lunar X Prize. And we would also be interested in doing that to design 3D printed cost-effective ventilators on an accelerated timeline of 30 to 60 days, provide grants to companies that use 3D printers to build mass-produced medical gear and equipment, and mandate production of testing kits and medical equipment that we need across the board based on how much we project we're going to need, not based on what the corporations want, but based on what we are going to need to save lives. And as we saw in World War II and what our plan outlines, this helps the economy. This jumpstarts the economy, and it prioritizes saving lives.
Awesome. Thank you. I think Mariana had her hand up.
Yeah, I'd like to talk about the testing exactly. And so I'm going to have you guys notice that I'm in my bedroom. And that is because there's members of my immediate family, my 5-year-old, my husband, and my daughter who are all coughing. My son has had a fever for 5 days, but I can't get him a COVID test because he doesn't qualify because of his symptoms aren't bad enough. Well, so I'm a healthcare worker. I had the privilege with my Kaiser Health Insurance to go and get a COVID test because I have a sore throat and a headache and I'm not feeling that great. So I went and got a COVID test so that I could know if it was in my home. Like, this is real stuff right now. I'm missing work for the next 6 days so that I can find out if this test is positive or not. And I think it's really wrong that these tests are not available to everyone. That is the way that you control a pandemic. You test, you control, and you isolate. That's what you do. And they're not doing that. And I think that it's an absolute failure of our system, healthcare and otherwise, that we're not taking care of people the way we should. You're talking about flattening the curve. Well, we're not flattening the curve, guys. And this is wrong. We need to make sure that we are doing everything that we can personally, because obviously we're not going to get everything that we need from the government right now. We're just not. So stay home, stay well, operate under the assumption that everybody you see is infected and you are too, and you don't want to give it to anyone. That's how I'm doing it for my life. As soon as this test is negative, I'm sure it will be. I don't have a fever. I'll be back at work 60, 70 hours a week, whatever it takes to take care of all the people that need me.
Oh,
awesome.
Thank you, Mariana.
Yeah, thank you so much for all your hard work, dedication, and yeah, I too had that same similar situation where I think there was people in my house with it, went in for testing, and was only able to get a strep test.
Well, I couldn't, in all honesty, I couldn't go to work and possibly infect anyone else at my job. Um, if I had any inkling that I might be spreading this, I've been all over the state, and all of us have. The last couple of months, I've been from Port Angeles to Vancouver and Tacoma, everywhere, with all kinds of groups of people. I don't know what I picked up and what I've been spreading around, just because I didn't know. We didn't know, so we didn't know soon enough. So I couldn't go against my own integrity and go to work, hand this around. So I have to know, and then I will put in the time that's needed to take care of everyone.
All right, is there another question? We still got to get to our action items. We still have just a little bit of time.
I have a question. This is a little bit tangential. We talk a lot about healthcare costs, but one of the consequences of this virus is a high death rate. Does anybody support death benefits? And do you think they can be included into a Medicare for All system, birth to death?
Absolutely. That can be integrated into any bill. It's. I know that it seems like it's a lot, but in the scheme of how much healthcare costs, $6,000, $7,000 for some death benefit, it is affordable. We can put it in there.
I would like to think that one of the things that is going to be there's the need for death benefits to help families get back on their feet after their income earners have passed away. But the other side of that is we can't, and this is one of the reasons why Medicare for All is so important, is that we can't be in a situation like my friend Scott here in Everett, who was a community transit driver and died 2 days ago after having the coronavirus for a period of 10 to 14 days. We are having to fundraise for him to pay the medical bills. He was in hospital, I want to say, for at least 10 days with this virus before he passed 2 nights ago. And he leaves behind a wife, 2 daughters and a son. Our daughters played soccer together. While the family is grieving, they are also faced with these monstrous bills that they don't know how they're going to pay. Your only focus in a time of crisis like this is how do we emotionally heal? How do we take care of each other? How do we get through the basics of every single day when these kids have lost their father and this wife has lost her husband, and to deal with having to pay tens of thousands of dollars of hospital costs on top of that is absolutely unconscionable. So, in terms of a death benefit, just having Medicare for All that covers all of those costs is in itself a death benefit, because you are not going to be saddled with all of these monstrous bills on the backside of things. The other thing I wanted to say is, and this is in my region locally, and most of you guys know this story, and I know that you guys were trying to reach out to this ER physician, but there's a hospital up in Bellingham, it's called Peace Health's St. Joseph's, and it is a Catholic hospital, and there was an ER physician who was fired. It was either yesterday or 2 days ago, because he was publicly complaining that the hospital was not, that their cleaning and safety and check-in procedures for people who were trying to get into the hospital and get themselves tested. They don't know if they've got the virus or don't have the virus, but people are coming to the hospital to get tested, or for any reason. And he was publicly saying for a week our procedures to make sure that these people who are coming to our hospital, if they are infected, are not passing it on to all of the other people who are coming to the hospital. Our procedures are inadequate. He got fired for saying that. Now, this is a supposedly nonprofit hospital, as many of our local hospitals are supposedly nonprofit. But the CEO of this hospital group has $1.5 million salary, and there are probably 8 or 10 board members who are bringing down $750,000 a piece, and that's where this money is going. This money going to hospitals is it's going to CEO salaries. It is not going to patient care. And I will say also that somebody like the guy I'm running against is fine with this system, because the American Hospital Association has given Rick Larson $28,000 for his campaigns over the course of his 18 years. And again, we can't get better because our politicians are bought off.
Ah, awesome. Not awesome, but damn. Wrong word. Any last little bits from the audience before we move forward? There's lots of things to do for us to start pushing the system to where we need it to be for a universal single payer healthcare to be enacted. Any last bits? No? Oh, Courtney's doing something.
Oh, no, I was just getting ready to be available to you.
Okay.
No, I'm gonna do a last bit. I gotta say this because I took a bunch of notes before here, and I don't want to cut anybody off. But if nobody is saying anything else, I'm gonna say this one thing. Trump is now talking about having to go back to work, and he wants everybody to go back to work so that the economy doesn't fail. Well, I'll tell you what, the economy is already failing. What are we gonna do to take care of people? Unfortunately, he says nutty things, but understand that this is not just Trump. This is our whole bought-off corporate system when we're talking about the health of the economy. So this is corporate Democrats also. He makes a statement like the cure can't be worse than the disease, and I wonder what he is referring to. What is the cure and what is the disease? Okay, because the disease is not getting people the treatment that they need. That is the disease. So the cure is getting people the treatment that they need. That is and so these politicians are framing things in terms of economic benefit for their corporate donors. We can't have the corporation shut down because the people who are giving us money are not going to this. Their shareholders are not going to be profiting from their stocks, or the CEOs are not going to be getting their salaries. We are completely living in a topsy-turvy world when we talk about things like the cure can't be worse than the disease. The only thing that should be important is making sure that people are safe, healthy, taken care of. You will see a healthy economy when you have healthy people. And I can't for the life of me understand why. I can. I understand it. But in any logical, rational world, how is it that we don't recognize that our economy will best function when our people are healthy? And how is it that we are not making that the number one priority? The health of our people and the health of our environment, and everything else will take care of itself.
Thank you. Totally agree. You do have something, Christopher? Did you have something you needed to say, Christopher?
Yeah, sorry about that. So, and I completely agree. Over the course of this campaign, our district is 25% bigger than New Jersey. We visited over 30 towns in our district, places that are deep, deep red, towns of 700 people. We were horseback riding with a rancher a few weeks ago, and he was talking about how he was open carrying his gun, and he was talking about how he could totally get on board for Medicare for all. He's sick of going from job to job and not having health care, or having it disappear, or having it be completely out of his control because your employer-based health care has nothing to do with what you want. And, in the face of this crisis, we already know that most Americans are on board for this, and doing what we can to be advocates for Medicare for all, for single payer healthcare. It's not something that ends after one election. It doesn't happen immediately. One election doesn't end, one person doesn't get elected, and all of a sudden it's figured out. All of a sudden we have it done. We have a lot going against us because when those corporations, when those pharmaceutical companies, when those insurance providers charge you outrageous amounts, the money you have to give them then goes to their lobbying, then goes to their funding of political campaigns. And so they're not going to stop fighting. They're not going to give up. And so we better keep that fight going, because it's not just for me. It's not just for you. It's for the people we don't know. It's for future generations. And the fight has to happen. So I just wanted to add that on there.
Oh, very much appreciate that. Thank you. All right. So with our revolution, we're fortunate, like I said, from the beginning, that not only do we get to be able to get behind and really fight for all the issues that we are all desperately needing, from Medicare for All, Green New Deal, all the things, right? We get to find and get behind progressive candidates who can help enact these policies that we desperately need. So we're very happy and thankful that you guys are all able to join us tonight. Standing up and running for office takes a lot of I was gonna cut, but I won't. So thank you guys for stepping up and giving us somebody to rally behind. And we do want to make sure that everybody understands that. I know they're not actively asking for money because of what's going on, and we can't go door to door. But there's many ways to help out. So please reach out. Those that are watching on YouTube, and if you're not watching on there, please come to the YouTube channel, UpHill Media. We'll be sharing that out. But in the description, there's a little drop down. I don't know if everybody realizes that, but in the description are all the links to all the websites that we've talked about tonight, all the candidates where you can find them. So everything is in there. So please go to that and use that as your base, copy and paste it if you want. So this last little bit, we're going to be running just a little bit over, but this last little bit is actions, right? What we can do. And in this drop down, again, like I said, there's links to these. There's a few ways that you can help. You can go, please go to the ourrevolution.com/page/Medicare -voter. Please sign up as a Medicare for All voter. That'll help get you into our revolution and all the things that we do, and we'll get your info and you can come in and help with Washington State. There's that pledge signature drive, or signing up to volunteer through Whole Washington. The link is there. We have phone banking. Right now we do them on Fridays and Sundays. We'll most likely expand as we get going, but you can sign up through the Mobilize link there. There is trainings on Sundays at 3:30, and then we start calling at 4. And then now, what we were talking about earlier, the Medicare for All resolutions. I'd like to bring in Tom again. Tom is from HealthCare for All Oregon. And he has been working on passing resolutions in Oregon for a while. He's done some city and I think county and other things. So Tom, will you do you mind talking about what you guys have been doing there?
No, I'm ready to go for it.
Excellent. Let's go, Tom.
I'm a clinician, so like the next patient is in, it's time to move on, right? So, okay, so I can share my screen, can I?
Yes.
I'm Tom Sinsick with HealthCare for All Oregon. We've been actually working with Melinda St. Louis and the Medicare for All group, had her out here, and we coordinated with her for the single payer conference in Portland in October. And the model resolution that we have at HealthCare for All Oregon, that's hcao.org, is built and in conjunction with Melinda St. Louis and the Medicare for All campaign. They've been passing resolutions in Oregon for many years. So the fact that Washington is first, or Seattle, I think this is like, sorry, not quite right, because I will show you. I'm going to go to the website. I got to share here, all right? Share screen. Somebody got some concerns there. Let me go to there. This is our website. Everybody in, nobody out. Common theme. We've got a thing called legislation. Under that, it says local resolutions. And in there, It shows where we have passed local. We have a map where local resolutions have been passed in Oregon. Some of those are listed right here, and the date and time: 2016, 2017, 17, 18, 17, 18, 16, 17, 19. So there's a bunch of them in different locations. But in addition to, governmental legislation like cities and counties, we've been also working on organizational. So you hear that the Oregon State Grange has actually passed a resolution. That was in June of 2019. And also not yet up is the Oregon AFL-CIO passed a resolution in, I believe, October of 2019, which we've got to add to this. So our information, which is more basically state-based, and we have a, let's see, local under our act, you want to do, that's the information about the legislation that's been passed. Who can do it, where, when, how, a whole system, some resources, including the current HCAO model resolution. Let me see if I can bring that up. That people can adopt. Every governmental body has its own way of doing things and stating resolutions. So I wouldn't be too particular about exactly the language, but the idea of including what's important going forward. References in this case to Oregon law, since this is Oregon thing. References to federal law, Oregon House of Representatives. References to both the Medicare for All Act and Medicare for All, let's see, the state-based item. So the addition that would now come on here would be in support of the state-based Universal Health Care Act to help us as states. And so there's the resolves, and it includes both what we want our government to do, our Oregon state government to do, or what we want. It says name of government entity. What are you asking this governmental entity to do? If it was the state, in this case, we're asking our governmental entity to call on federal legislators to work towards an immediate enactment, right? Or here, federal delegation to create pathways for states to do it. That would be the State-Based Universal Health Care Act. So as you can see, these things have to be adaptable. And this is the model we're using for Oregon. And people can go to our website and do this. And we have some tips for successful campaign, not too complicated. It begins with one person or a small group of people. The idea of getting, let me get off of this, I think. I'd rather see people. There's the previous resolutions link there, which I showed you. Sometimes I scroll too fast, but the main thing is for people to go to hcao.org or the Medicare for All public citizen site, either of those places, and gather information that works for the community that you're working with. But any governmental body, school board, city, county, a key element, of course, is finding the one person that might be your advocate inside that governmental body. Makes it a lot easier. And I would suggest go for the low-hanging fruit. Don't fight like someplace where nobody's in favor of this. Start working up numbers in the easy places, because although our system, we want everybody in and nobody out, we don't need everybody to get this stuff passed. We just need enough people and enough action going forward. So with that, if that's clear enough, I can take any questions.
Oh, sorry, I was talking with being muted. I apologize. Yes, that is clear. And we do want to open it up. There was one question from earlier, and I think it ties into this piece as well. This is from Joshua Copeland. He's with local Bernie Kratz. And he really focuses on getting local candidates, getting local candidates elected. And this is where we do want to find those people who are running for those local offices. When you ask them about if they support or will champion, a Medicare for all system, if they let you know that it's not at their level, it is down to our local levels. We have to get local to start getting this passed statewide and federally. So what do you guys think? He was asking you, what do you guys think are some of the important pieces of being able to, all levels of government?
I have a comment on influencing elected officials or candidates to come.
Oh, please do.
Yeah, so one of Whole Washington's strategies and how we got the most endorsements is to let people know when they do endorse Whole Washington, we'll share their endorsement on social media. Tweet it out, share it on Facebook, send emails to our supporters, because we have a lot of supporters in the state. So a lot of candidates and elected officials kind of want to know what's in it for them. So if you tell them that by demonstrating their support for HealthCare for All Oregon or Whole Washington or Medicare for All, that you'll let your supporters know that they're a strong advocate for universal healthcare, that does go a long way with these candidates. Of course, candidates on this call, you don't need to do that because they just believe in it because it's the right thing to do.
Exactly. Thank you, Georgia. Anybody have any questions out there for Tom? I know that Georgia was a part of the Seattle one as well. Did you guys go around and do any petitions first to find out who are supporters to take that to the city council?
So I've moved. Now I'm in Eastern Washington. And I do want to start a resolution drive here. Spokane would be the closest city to do that in. But when I was in Seattle, we are very lucky to have Council Member Shama Sawant, who is a huge advocate for all things progressive, all of our values here with the Bernie-crats. And so her office wrote the resolution, and she asked Whole Washington to bring in a lot of supporters, a lot of our volunteers, so that the other city council people got to see how many people believed in Medicare for All and universal healthcare. And that, I think, combined with Shama Sawant's amazing speech that she gave before the resolution was read, helped get it passed. So that's one thing that you definitely want to consider, is recruiting for a large amount of people to come to testify for the resolution.
Excellent, thank you.
Oh, and thank you also to Jason Call for reminding me about the Washington State Democratic Central Committee vote a couple years back when we endorsed Pramila Jayapal's bill. Again, like that, getting your local Democratic Party organization to pass resolutions and then move that up to your state party really is an amazing way to get media attention for the bill and to get word out. So when a central committee meets, it's people from all over the state, and they might not have heard of the great bills that we have to get universal health care, both statewide and nationally. So that's definitely something that you want to do. Any organization, DSA, Indivisible, all of those organizations can endorse these bills.
So I think what I would add in this is that really lay out your strategy. If one person can talk to, like I did, one county commissioner, like we did in Multnomah County, and they're ready to take the lead on it, let them take the lead. And then you have a bunch of people showing up at the hearing and it's a done deal. Don't burn up more energy than you need to get something on the books, because what you're trying to do is get an impression and get some media. Now, if you look at our list, we've got some very small communities. So the fight wasn't always easy. If one of them was the city of Albany. It was a 3-2 council vote. and one person wavering, and then people showed up to testify to create that vote in the one little conservative city of Albany into the small place in Oregon, and then little talent Oregon. So lay out your strategy. Who are the people who are going to be involved? And what do you really have to do to get the job done? And obviously, if you can get media attention to get that more expanded, that's really good. So thanks.
I just wanted to throw in there that it's great to, I'm one of the whole Washington volunteers. I am also on the state platform committee. So I will be pushing to keep this in the state platform, and for tougher, I would say, tougher penalties for additional people who want Democratic Party endorsement that don't actually support our platform. And I think that's really important to hold people accountable. But I also just want to shout out to wholewashington.org. They have an amazing website. There's tons of training and information, and it's a very well put together place that you can actually learn to be trained and go to your local areas. I also want to put a shout out in for unions. We really want to get union support behind this and labor, and make sure that people know that they can do this from all angles. It doesn't have to be part of the party. It can be, I've taken resolutions to just employers, to box stores, to, you can get any level of if basically anything more than 3 people, they can sign on to support this and get that passed.
Jason has something.
I'll also add that if you can stomach going to your local Democratic Party county or legislative district meetings, if you can, we have an important date coming up here in mid-March when all of the candidates who you have met tonight will be filing for their office. You can also file for the PCO office. The reason I tell you that is because the PCO is the lowest precinct committee officer. It is the lowest level elected office in the Democratic Party or the Republican Party for that matter. But that gives you voting power on who gets your endorsements. Now, one of the things that we have had happen in the 44th legislative district here where I am is we had one of our county council members just retire. He took a high-paying job somewhere else, and so that opened up a vacancy. Well, the guy who is the likely appointee for that vacancy on the county council is our freshman legislator. I mean, we just worked hard to get this guy elected to Olympia, and now he wants to come back and take that county council seat. He's got personal reasons for doing it. I don't think it's a good decision. But what that allows us to do now is appoint a legislative seat. And the people who have the power of that appointment are the PCOs. The PCOs get to vote on the top 3 nominees who will get that appointment for the 44th legislature and then be essentially the incumbent in office. So you have some power if you are willing to take on this office and go to the meetings and vote where you need to. And yes, there's a lot of nonsense sometimes that you got to sit through. And yes, the Democratic Party is divided. And so, you've got the Bernie Sanders wing, and then you got the corporate centrist wing, and there's a lot of loggerheads there. I'm not gonna sugarcoat it for you, but if we can get in at that level and maintain that power within the party, we can influence who is going to represent us in the legislature, especially around this time where you have appointments. Now, I also want to say with that is if you have that voting power in your district, in your legislative district or your county Democratic Party, what one of the districts up here, the 21st legislative district, has done, and they've made it part of their bylaws that you cannot be endorsed by that district if you do not support Medicare for all. You have the power to write those rules if you are involved at that level. So I highly encourage it. I know for many people watching here, it may be thoroughly distasteful, but we do have an opportunity to seize some power, as it were, that we have been trying to do over the last 4 years. It's hard to get people to stick around. So if you're going to do it, please stick around and show up to those meetings. But that's exactly how Mariana and Georgia and I all got ourselves elected to the state committee. We worked hard to get people to file for this office, and they in turn supported us to be members of the state central committee. So, give it a shot.
Thank you, thank you. And yeah, we will be doing actually another one of these events kind of around that. There's going to be some more meetings actually very shortly regarding that piece to it. Thank you, Jason. Tom does have to leave. Like I said, we are a few minutes over. So anything left for Tom before we say goodbye to him? Or Tom, anything else you want to make sure you say before we head out?
Thank you for this opportunity. Go Washington. Go Oregon.
Oregon's next. So that is one thing. So we are our revolution, and we are more than just a state group. It is a national organization. And Emma in Oregon is working with us. So hopefully we will be helping to get this going next in Oregon. And I'm sure you'll be a big part of that too, Tom. So we will see you soon. Thank you again. All right, Amber, do you want to go through our events that are coming up? And then I think we're about finished.
Yeah, I know Oz was queuing up some finishing music for us. Thank you for pitching in. We're a little over time that we'd planned, but we're all adjusting to these things. So thank you very much. So what we have going on, our Revolution Washington Bernie-crats, we are going to be doing these town halls every Saturday night for you from 7 to 9. So we'll cover a bunch of different topics. We will definitely make healthcare for all, Medicare for all, a big piece of that. We are also going to continue with our phone banking. Obviously, that's something that we can all do from home. Many of us have a lot more extra time. Right now, we have scheduled to do those every Friday from 2 to 4 p.m. It's online. We have a calendar, we have links, and then we do them every Sunday at 3:30. We start with an online training, and then the calls go from 4 to 6. You just need a computer and a cell phone. Headset's ideal if you have it, but not required. And it's the same dialer that the Bernie campaign's using. So if you've done any Bernie volunteers or calls, it's very similar, except for you're calling people for our revolution. And what we want to do is we want to keep building people in our state and beyond. We also want to help get our endorsed candidates and initiatives like Whole Washington pushed forward. So there's a huge focus on that in the next coming months. We're also going to be doing some informative things about being in a campaign, as well as some of the changes that are happening with the caucuses for picking our national delegates. If not, we're going anywhere, or maybe we'll be having conventions from home, TBD on that. But we are going to be having these conversations on Friday night. We also have an 11 a.m. check-in every day, just health and wellness. How are you doing? Love for you to join us on those. We're going to be doing some resource and community mutual aid mapping as well. Make sure everybody's got what they need. And we want to keep building with our community. We have weekly meetings at 7:30 on Sunday nights. So anything else I missed, please hop in, Rhonda or Courtney.
I think we're good on that. Courtney, anything you want to say towards the end here?
Well, it's a little off topic, but I look forward to us putting forth a COVID-friendly neighborhood outreach process. And I'm dropping this on Rhonda and Amber as well. So surprise. So I would like to have about an hour Zoom broadcast based just on how to network your neighbors in a time of health crisis. So responsible and respectful of the reality.
Already on the books, babe. Already on the books. Not surprising at all. So yes, that'll be part of the COVID and mutual aid. Perfect segment in that for that piece. All right. Thank you, everybody, again for watching in all of the spaces that we're able to push out tonight. Special thanks to our guests, for taking the time out and hanging with us for the last couple hours as well. And again, Oz, for all your magic you do behind the scenes to make this production as beautiful and seamless as possible. And to all of our candidates, again, thank you for stepping up and thank you for taking your time with us. And you guys have a beautiful night. And every Saturday now we're going to be doing something. So stay tuned. And then again, join us with our daily meetings Monday through Friday at 11 a.m. All right, let the music roll.
Time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices. Till they hear us in the halls of government and behind each corporate door. That we're sick and tired of getting less and less while paying more and more. Put people before profit. Join with many doctors, nurses, and other concerned Americans in support of America's best and most affordable health care plan. Single-payer, improved Medicare for all. Let them hear us. Medicare for all, because healthcare is a right. Medicare for all, and the U.S. saw the light. That the best healthcare plan is a single-payer plan. Now's the time to finally put it on the table. Contact your legislators and tell them to save Medicare as we know it and expand it into Medicare as we need it. Improved Medicare for all, because your interests are special too.